Today, we will explore the fascinating science behind appendicitis and uncover the hidden secrets of the human appendix. The appendix is a small pouch attached to the beginning of the large intestine, located exactly in the lower right abdominal area. For many years, scientists believed this tiny structure was just a useless evolutionary remnant, completely devoid of any real biological function whatsoever. However, modern medical research has revealed that this small organ actually plays a surprisingly vital role in our complex immune system defenses. Let us take a closer look at the actual anatomy of the vermiform appendix by examining a highly detailed medical computer visualization. Notice how it attaches directly to the cecum, forming a blind-ended tube extending into the lower right quadrant of the abdomen. The exact position can vary slightly among different individuals, making the diagnosis of its related medical conditions quite challenging for many doctors. Inside this narrow tube, we find specialized lymphoid tissues that actively help our body monitor and control various types of intestinal bacteria. This lymphoid tissue acts as an intelligent security checkpoint, continuously scanning the passing digestive materials for any potentially harmful biological microbial threats. Beyond immune surveillance, scientists now propose that the appendix serves as a secure safe house for beneficial gut bacteria during severe illnesses. When intense diarrhea flushes out your normal digestive flora, the appendix releases its stored good bacteria to help reboot your delicate system. This bacterial reserve ensures that your digestive tract can quickly recover and return to normal functioning after experiencing a severe gastrointestinal infection. Despite its helpful nature, the narrow structure of this tiny pouch makes it highly susceptible to dangerous blockages and subsequent inflammatory conditions. Appendicitis officially begins when the inner lining of the appendix becomes blocked by some form of physical obstruction or swollen lymphoid tissue. The most common culprit behind this dangerous blockage is a hardened piece of stool, medically known by doctors as a calcified fecolith. Occasionally, foreign objects, undigested seeds, or even rare intestinal tumors can accidentally lodge themselves tightly within the narrow opening of the appendix. In young adults, viral infections can cause surrounding lymphoid tissues to swell massively, pinching the tiny appendiceal tube completely shut without warning. Once the passageway is blocked, the mucus normally secreted by the appendix has absolutely nowhere to go, causing steady internal pressure buildup. Trapped bacteria inside the closed space begin to multiply rapidly, triggering an aggressive immune response and causing the organ to swell significantly. As the pressure continues to rise steadily, it compresses the small blood vessels supplying the appendix walls, leading to dangerous tissue ischemia. This lack of adequate blood flow slowly starves the appendiceal tissues of essential oxygen, making them incredibly vulnerable to severe bacterial invasion. The inflammatory process follows a very specific and predictable pattern, which directly correlates with the unique progression of pain experienced by patients. Early on, the distension of the appendix activates visceral nerve fibers, generating a vague, dull ache near the central belly button area. This initial discomfort is known as visceral pain, and patients usually struggle to pinpoint its exact location on their sensitive abdominal wall. The brain misinterprets these early warning signals, projecting the sensation to the mid-abdomen because of shared embryonic neural pathways in humans. As hours pass and inflammation aggressively worsens, the swollen appendix eventually makes physical contact with the sensitive inner lining of your abdomen. This lining, called the parietal peritoneum, contains highly precise somatic nerve endings that can accurately localize the exact source of tissue damage. Suddenly, the vague central ache shifts dramatically, migrating downwards and settling firmly into the lower right quadrant of the aching human stomach. This classic migration of severe pain is a hallmark clinical sign that doctors actively look for when diagnosing acute cases of appendicitis. The localized pain becomes incredibly sharp and intense, often worsening significantly with any sudden movements, deep breathing, or simple fits of coughing. Pressing down on the lower right abdomen and releasing quickly will often trigger a sharp spike in agony, known as rebound tenderness. Alongside the migrating abdominal pain, patients frequently experience a sudden and complete loss of appetite, refusing even their most favorite delicious foods. Nausea and vomiting are also incredibly common early symptoms, occurring shortly after the onset of the initial vague abdominal discomfort and cramping. A mild fever often develops as the immune system ramps up its systemic response to fight off the localized harmful bacterial infection. If left completely untreated, the escalating internal pressure will eventually compromise the structural integrity of the weakening appendiceal wall, causing catastrophic failure. The weakened tissue ultimately succumbs to necrosis, tearing open and spilling highly toxic bacterial contents directly into the sterile abdominal cavity space. This dangerous event is widely known as a ruptured appendix, a severe medical emergency that requires immediate surgical intervention to save lives. Once ruptured, the localized infection can spread rapidly throughout the entire abdominal cavity, causing a deadly condition medically known as generalized peritonitis. Peritonitis causes the entire abdomen to become rigid and exquisitely tender, often leading to systemic septic shock if not treated promptly enough. Fortunately, the human body has an amazing built-in defense mechanism to help contain this explosive bacterial spill and prevent widespread infection. A large fatty apron of tissue called the greater omentum physically wraps itself tightly around the inflamed appendix to seal off leaks. This remarkable protective action successfully confines the dangerous infection to a small localized area, creating what doctors call an appendiceal pus abscess. While an abscess prevents immediate peritonitis, and it still requires urgent medical drainage and heavy antibiotic therapy to properly clear out the infection, diagnosing appendicitis quickly is absolutely crucial. Utilizing advanced physical examinations, detailed blood tests, and high-resolution medical imaging techniques like modern scans. Elevated white blood cell counts clearly indicate an active ongoing infection, while ultrasound imaging visually confirms the swollen state of the appendix. For many decades, the absolute gold standard for treating acute appendicitis has been the complete surgical removal of the infected organ itself. This life-saving surgical procedure, known as an appendectomy, is most frequently performed using minimally invasive laparoscopic techniques for faster patient recovery. Surgeons make tiny incisions, inserting a specialized medical camera and precision tools to carefully detach and extract the diseased appendix safely outside. A laparoscopic surgery leaves minimal scarring, reduces post-operative pain significantly, and allows patients to return home within just a few short days post-operatively. In recent years, medical researchers have extensively studied the possibility of treating certain mild cases of appendicitis using only strong intravenous antibiotics. Studies show that antibiotic therapy alone can successfully resolve the inflammation in nearly 90% of carefully selected, uncomplicated acute appendicitis cases. This non-surgical approach seems highly appealing, completely avoiding the inherent physical risks and potential complications associated with general anesthesia and surgery. However, relying solely on antibiotics carries a significant long-term risk, as the underlying anatomical blockage within the appendix often remains unresolved. Consequently, a substantial percentage of patients treated only with medication will unfortunately experience a painful recurrence within the very first following year. Because of this high recurrence rate, surgery remains the most definitive and highly recommended treatment option by leading medical professionals worldwide today. Recovering from a routine appendectomy is generally quite smooth, provided the appendix was safely removed before it had any chance to rupture. Patients are strongly encouraged to walk soon after surgery to prevent blood clots and stimulate the swift return of normal bowel functions. Even without an appendix, humans can live perfectly normal, healthy lives, digesting food and fighting off common infections without any noticeable difficulties. The vast immune system and massive gut microbiome effortlessly compensate for the sudden absence of this tiny worm-like intestinal storage pouch. Understanding the complex mechanics of appendicitis highlights the incredible, intricate balance and potential vulnerabilities hidden deep within our amazing human digestive system. From its surprising role as a bacterial sanctuary to its sudden transformation into a surgical emergency, the appendix is truly endlessly fascinating. Remember to pay close attention to unusual abdominal pains, especially if they actively migrate towards the lower right side of your belly. Early medical intervention is the absolute key to preventing dangerous ruptures, avoiding severe complications, and ensuring a rapid full recovery from appendicitis. We hope this detailed scientific journey has provided you with a much deeper appreciation for this small but mighty organ inside you. Science continues to reveal new mysteries about our anatomy, proving that even the smallest body parts hold incredibly complex and important secrets. Thank you for joining us on this educational exploration of human anatomy, disease mechanics, and modern medical treatments available in hospitals today. Thank you for watching Video Creator. Please subscribe for more incredible medical science videos, and we will definitely see you next time.